બેઝિકલી આજનો સેમિનારનો હેતુ એ છે કે આપણે જાણીએ નોર્મલ ગ્રોથ શું છે. આઈ એમ શ્યોર એઝ પેરેન્ટ્સ એવરીબડી ઇઝ કન્સર્ન, એવરીબડી હેઝ ધીસ ક્વેશ્ચન્સ ઇન માઇન્ડ કે મારું બાળક બરાબર મોટું થઈ રહ્યું છે કે નહીં, એમ આઈ ડુઈંગ અ પરફેક્ટ જોબ ઓર નોટ, રાઈટ? એટલે મને લાગે છે કે આ વસ્તુ દરેક પેરેન્ટ્સના મગજમાં હોતી જ હોય છે કે ભાઈ જે બધું થઈ રહ્યું છે બરાબર થઈ રહ્યું છે કે નથી થઈ રહ્યું. So today we are going to learn some basics of growth hormone. I think that is very, very important for all of us to know because that is going to answer a lot of queries that you have in mind. એટલે આપણે શું કરીશું, એક આ કલાકનો સેશન છે. So initial 20-25 minutes I will be talking and the rest we can have an open Q&A. You can raise your hand or you can put your question in the chat box and we'll try to answer as many questions as possible, right? So the main question: is your child growing well or not, right? So what do we mean by growth? Barobar ne? So when I say I'm a pediatric endocrinologist, I am a doctor who deals with the growth disorders of children, right? પણ કોઈ પણ વસ્તુ abnormal છે કે નહીં એ જાણવા માટે આપણને એ ખબર હોવી જોઈએ કે normal શું છે, તો આપણને ખબર પડે કે abnormal શું થયું, right? So if we know what is normal, we can then find out if anything is abnormal or not. So what is normal growth? It is defined as changes in the weight, height and the head circumference. Head circumference એટલે માથાનું માપ, કે જે આપણને આપણું બ્રેન ડેવલપમેન્ટ કેવું થઈ રહ્યું છે, મગજ બરાબર મોટું થાય છે કે નથી થઈ રહ્યું, એનો આઈડિયા આપે છે, right? The most important thing for us to remember is that growth is a dynamic process. રાઈટ? કેમ બાળકોના અલગ ડોક્ટર, કેમ પીડિયાટ્રિશિયન અલગ, કેમ બાળકોની સ્પેશિયાલિટીના ડોક્ટર અલગ? કારણ કે બાળકથી મોટા થવું એક ડાયનામિક ફેઝ છે, રાઈટ? તમે 1 વર્ષના હતા, પછી તમે 2 વર્ષે, તમે 1 વર્ષના ફરી નથી બનવાના, right? So there are a lot of changes that happen in your body, both in the physical and the mental development. So we always say that growth is a dynamic process. It is not a static process. આપણે મોટા થઈ ગયા, 18-19 વર્ષના થઈ ગયા પછી આપણો ગ્રોથ થવાનો, ફિઝિકલ ગ્રોથ થવાનો અટકી જશે, રાઈટ? પણ ત્યાં સુધી growth is always going to be a dynamic process and therefore we need to know what is normal growth. So why is it important that our child grows normally, right? Why are we always so concerned and we, like, whenever you visit a doctor, the first question we ask is, sir, is my child growing normally or not, right? So a child should ideally be growing according to his or her genetic population and according to the population. So આપણે બે વસ્તુ સાથે કોઈ પણ બાળકના ગ્રોથની કમ્પેરિઝન કરીએ છીએ. એક તો કે જે એનું ફેમિલી છે, માતા પિતા છે, તો એના જેનેટિક પોટેન્શિયલ પ્રમાણે ગ્રોથ કેવો થઈ રહ્યો છે, and at the same time how is the child growing according to the population, કે ભાઈ એ જ ઉંમરના આપણે બીજા બધા બાળકોને લઈએ તો how is my child growing in comparison to that, right? So a child should ideally be growing according to the genetic potential and also according to the comparison with the peers. A normal growth suggests that all the hormonal systems are intact, the child is receiving good nutrition, the child does not have any active disease, or if there is a disease, that disease is well under control, right? So end point શું છે કોઈ પણ વસ્તુનો, કે ભાઈ મારું બાળક is growing well, that means whatever is happening or whatever the child has been through, that is all under control, that is all being taken care of, and now my child is growing normally, right? So that is why it is so important for us to make sure that the child is growing well. So what is normal growth? Now remember the first year of life. એક બેબી જ્યારે બોર્ન થાય છે, 2.5-3 કિલોનું બાળક હોય છે ને વર્ષ થતા તો બાળક 9-10 કિલોનું થઈ જાય છે, right? So first year of life is the time when the baby grows the maximum. So triple the birth weight and around 25 centimeters the baby gets longer. No, this is such a big, આટલું તો fast growth આપણો લાઈફમાં પછી ક્યારે નથી થવાનો. So baby at birth is around 50 centimeters and then at 1 year the baby becomes 75 centimeters. In the next 2 to 3 years, the baby again grows slightly faster, right? So about 7 to 10 centimeter per year, gaining about 1 to 2 to 3 kgs per year. So this is called the rate of growth. And once the child is 3 to 4 years of age, they will settle down into a normal growth pattern. એક simple way માં બાળક grow કરશે until they hit puberty. So until their hormonal changes start, they will grow at about 4 to 6 centimeter per year, gaining normally about 1 to 2 kilogram per year. So this is, now when I say this, it may be different for other kids. This is like a rough estimate of how a child usually grows. So then the question comes, ma'am, how do I know whether my child is growing well or not, right? So remember, if you have got any concerns regarding the growth of your child, the silliest of the concern, please see your doctor, because I think that a silly concern but important hoy chhe, right? And nowadays we have got a lot of home monitoring tools, which I'll just show you a slide about it, by which you can monitor on your own the growth of your child. And if you see any concern in that, you can always see your doctor and express that concern, right? અમારી પાસે ઘણી બધી વખત બાળકો પેશન્ટ્સ આવતા હોય કે મેમ છેલ્લા 4-5 વર્ષથી એવું લાગે છે કે જોઈએ એવી હાઈટ નથી વધતી, right? But then why do you have to wait for 4 to 5 years, right? Those years we could have taken some action for the well-being of the child, right? So if you feel that the child growth has been affected, both in terms of height or weight, it is very important to express that concern with your doctor. Then let your doctor decide whether this is normal, abnormal, or something has to be done about it, right? So today, my focus mainly is to teach you exactly what we mean by all these things, right? So the most important part of my today's talk is going to be a bit about the growth charts. Now, growth charts basically, આપણે જે 10th, 12th માં આપણે જે graphs ભણતા હતા ને, growth charts are basically that only. Those small squares are there, and you would find these growth charts at the back of your pediatrician's file, where they will be checking your height and weight and putting them on the growth charts, right? So they basically measure your height, your weight, your head circumference, the body mass index. તમે બધાએ સાંભળ્યું જ હશે, કોઈ બાળકની obesity છે કાં overweight છે, તો તમારા ડોક્ટર શું વાપરે? Body mass index, right? But these graphs are very different because they have got multiple lines on the graphs, and these lines have been made from the study of large number of children, right? હવે suppose મારું બાળક Indian હોય, તો હું મારા બાળકની નોર્થ અમેરિકન બાળક સાથે comparison ના કરી શકું. હું કોની સાથે comparison કરી શકું? હું Indian બાળકો સાથે comparison કરી શકું. So આવા જ બહુ જ બધા બાળકોને લઈ એમનો સ્ટડી કરી, એમના ગ્રોથ પેટર્નની સ્ટડી કરી અને આ ગ્રોથ ચાર્ટ્સ બનાવવામાં આવ્યા છે, right? So they will tell us whether our child is growing, how well our child is growing in comparison to the population, so in comparison to all the other children, and also according to our genetic potential. એ સૌથી important વસ્તુ બને છે, right? So how do they look like? They look like something like this. Now remember, આમાં પણ color code છે. So blue is always going to be for the boys, pink is going to be for the girls, right? If you can appreciate, there is an upper column, અહીંયા બહુ બધી lines દેખાય છે. That is the height column, and this lower column is the weight. So whenever we check the height and the weight of a child, we plot the dots on these graphs, right? And they will tell us where my growth is going. બરોબર છે? So I hope this is clear to everybody. They are easily downloadable from the internet also. These are our Indian Academy of Pediatrics growth charts. જો અહીંયા ઉપર લખ્યું છે IAP growth charts. એટલે તમે IAP ની વેબસાઇટ પર જાઓ અથવા IAP growth charts એવું આપો તો તમે આને easily download કરી શકો છો, right? So the upper portion is for the height and the lower portion is for the weight. These are the growth charts that we use to monitor the smaller babies. જે નાના babies છે આપણે જો, they grow so fast, right? તો પેલા મોટા growth charts તો નાના બાળકોમાં ના ચાલે, right? So these are the WHO, the World Health Organization growth charts. અને એમાં તમે જો તો there is a third column in between, right? કે જે measure કરે છે તમારું head circumference. So we usually measure the head circumference until the child is 2 or 3 years of age. બરોબર ને? કારણ કે એ ટાઈમમાં આપણું ઉપરનું તાળવું ખુલ્લું છે, so brain મોટું થઈ રહ્યું છે. So what we want to see is કે brain બરાબર રીતે મોટું થઈ રહ્યું છે કે નહીં. So again in the upper portion, length or the height, In the middle portion, the head circumference, and the lower portion, weight. Right? અને આપણે યાદ હોય તો આપણે ભણ્યા હતા કે y axis અને x axis. તો x axis is always the age. તો આ એજ માટે બાળકની હાઈટ કેટલી છે, માથાનું માપ કેવું છે અને વજન કેવું છે, એના પ્લોટિંગ આપણે ગ્રોથ ચાર્ટ પર કરવાના છે. Right? And if you can see and appreciate, these are the lines. મેં થોડું એને amplify કર્યું છે. So if you can see, these are the lines and these are the numbers. 3, 10, 25, 50, 75, 19 and 97. So these are called the percentile lines. Now percentile is different from percentage, પણ roughly સમજાવું તો કે અગર આપણે એક જ ઉંમરના 100 બાળકોને લઈએ છીએ, રાઈટ, અને લાઇનસર ઊભા રાખીએ છીએ, તો આવી કંઈક લાઈનો આપણે બનાવી શકીશું, right? So what does this tell us? This will compare the growth of a child with the general population. કે ભાઈ આ એરિયામાં બાળકોનો ગ્રોથ થવાનો આ ટ્રેન્ડ છે, તો મારું બાળક ત્યાં ક્યાં છે, right? So this basically tells us how our child is doing. So sometimes the doctor must be saying, no, he is on the 25th percentile, so he seems to be doing fine. Right, so that is what we mean by the percentiles. And the right side, 170, 175, those are all your height in centimeters, right? Okay, so now how do we use growth charts, right? First thing that we need to know to use the growth chart is the accurate age. No, madam 7 વર્ષનો છે, and then we actually ask, 7મું તો હજી બેઠું છે, the child is just 6 years and 2 months, right? So always make sure that you give the exact date of birth, so we are able to calculate the age of the child, right? Then we need to accurately measure the height in centimeters, the weight in kilograms, any proper method which a doctor would be following. We then plot on the correct chart, so pink for the girls, blue for the boys. If there's a younger baby, we use those WHO growth charts, and then we do the interpretation. Okay, how is the child faring in terms of growth? We would then check the parents' height, because we said, genetic potential is very important. કોઈ પણ બાળકના growth માટે અમુક parameters important હોય છે. તો જો હું વાત કરું તો પહેલા 3 વર્ષમાં બાળક જ્યારે મમ્મીના ચમ્મીમાં હતું, તો મમ્મીની હેલ્થ કેવી હતી, મમ્મીને ડાયાબિટીસ, બ્લડ પ્રેશર, એવા કોઈ કોમ્પ્લિકેશન્સ હતા કે નહીં, બાળકનું જન્મ વખતે બર્થ વેઇટ કેટલું હતું, બાળક પૂરા મહિને આવ્યું હતું કે અધૂરા મહિને આવ્યું હતું, what was the initial nutrition period like. So all these parameters are very important for the first 3 years of growth, right? Along with the normal hormones. Once the child is 3 years of age, then your growth hormone, height vadharvano hormone, and your thyroid hormones, they are very, very important, because they're going to make sure that tamaro growth normal thai che. And then once a girl or a boy reaches an appropriate age, they develop their sexual characters. Sexual hormones come into picture. So then a child achieves the final height. So atla badha parameters involved che koi pan balakna growth mate. But the most important thing is the genetic potential. એવું કહેવાય કે 70 થી 80% genetic potential matter કરે છે, along with your normal hormones and along with the good nutrition. Right? So we would check the parents' height. અમુક formula હોય છે જેને અમે use કરીએ છીએ to compare the child's height with the familial potential. And then if it is abnormal or something is not right, we would investigate accordingly. Right? If anybody has any question in whatever we have discussed, you can just put up in the chat box. Please feel free to do that. And if any doubt lagyo atyaar sudhima, they can raise the hand also and we'll try to answer them. Right? Let us keep it interactive also. Okay. So I'm going to show you exactly, જ્યારે તમારા સામેની ચેર પર ડોક્ટર બેઠા છે, તો એક્ઝેક્ટલી લા ગ્રાફમાં શું કરી રહ્યા છે એ આપણે આજે જોઈશું. Right? So I've got a 9-year-old boy. Right? So I'm going to use a blue colored growth chart for that 9-year-old boy. Right? Okay. Now, the child's height is 130 centimeter. So my child's height measure kari, the height is 130 centimeter. So at 9 years, I'm going to plot 130 centimeters. Right? The weight is 23 kg. So I'm going to plot the weight. So now what I get is कि कई लाइन ની વચ્ચે મારું વજન અને કઈ લાઈન ની વચ્ચે મારી હાઈટ છે. તો હાઇટ જે છે that is between the 25th and the 50th line, and weight જે છે that is between the 10th and the 25th line, right? So then comes the question, ma'am, is this normal or not? Do you think my child's height and weight are normal or not? So as compared to the general population, it seems that he's doing just fine, right? Height seems to be more than the 25 percentile. Weight is also more than the 10th percentile. So I think it is doing fine. So just looking at the growth chart, I'm okay. I'm like, not bad. The child's height and the weight look quite okay. But the next step is to compare this child's height with the genetic potential, right? It is possible that the child's parents could be very, very tall. તો એના માટે આ height કદાચ નાની પણ પડે, right? So what we do is we need the mother's height and the father's height. We will use a formula to calculate the target height. કે ભાઈ આ બાળકની height કેટલી થવી જોઈએ in ideal circumstances. That is called a target height. But nothing is perfect. So you have a range, plus, minus, દરેક વસ્તુમાં કરવું જ પડે, right? So you have a range for everything. So this is your target height and this is your target range. એટલે આ બાળકની height જો આ રેન્જમાં આવી જાય છે, right? Then that child is doing just fine for the genetic potential also. So what we do is we just draw an imaginary line કે ભાઈ આપણને ખબર નથી કે બાળકનો ગ્રોથ કેવો થશે, પણ જો આપણે માનીએ કે બાળકનો ગ્રોથ આ જ રીતે થાય છે, then the child falls right in the target range for the family, right? So at this point of time the child seems to be doing fine, right? So the child, આપણે જોયું કે આ બાળક જે છે એ બીજા બધા એના ફ્રેન્ડ્સના કમ્પેરિઝનમાં અને સાથે એના ફેમિલીના કમ્પેરિઝનમાં બરાબર કરી રહ્યું છે, right? So this is how we come to a conclusion that okay, at this point of time the child seems to be doing fine and there is nothing to worry. Okay, so then how frequently do we check height? So we get parents, ma'am, અમે દર અઠવાડિયે height ઓલું આમ દિવાલ પર કરીએ છીએ પણ height તો હલતી જ નથી. So remember, between two height measurements there has to be a gap of at least 3 months, right? એની પહેલા તો હું ને હું height check કરું તો પણ ગડબડ આવશે, right? So there has to be a minimum 3-month gap between any two height measurements, and it has to be preferably done at the same place by the same person, right? કોઈ એક મહિને આવે ને કે મેડમ height check કરો, તો મારી ને મારી height measurement માં ગડબડ થઈ શકશે, right? So if you're even monitoring at home, do it once in 3 months. Vajan pan, if you have got a smaller baby, you want to check more frequently. But as the child grows older, once in 3 months weight check should be okay. So do not check more and more frequently, right? It's just going to give you more confusion. Okay. So then, when can I say that my child is not growing well, right? So let's take another example. I've got an 8-year-old child કે જેની height છે 105 centimeters. I'm going to plot 105. So growth chart પરથી તો મને લાગે છે કે બાળકની height તો આ last line કરતા પણ નીચે જઈ રહી છે. Okay. Now child is lost to follow up, right? તમે જુઓ છો પેરેન્ટ્સની height તો reasonable છે, 50ની લાઈન પર ક્યાંક ટચ કરી રહ્યું છે, but the child's height is quite less. Now this child doesn't come for follow up, and after 2 years what has happened is the child is 112 centimeter. Still down. એવું નથી કે ચાઇલ્ડનું કેચઅપ થયું, right? So often we have a misconception કે ભાઈ 16 વર્ષ સુધી તો હાઈટ વધશે, 18 વર્ષ સુધી તો હાઈટ વધશે, અત્યારે ભલે નીચી લાગે છે પણ પછીથી કેચઅપ આવી જશે, right? But I think 8 years પર when the parents felt that the child was less, એ ટાઈમે જ કંઈક એક્શન લેવાઈ જવાની જરૂર હતી, નહીં તો શું થાય કે નોર્મલથી આપણી હાઈટનો ગેપ વધતો જાય, right? So anybody who is persistently growing below the last line, those growths are abnormal, right? Something else. આ growth chart માં તમે જોઈ શકો છો કે પહેલું જે મીંડું છે ને એ તો નોર્મલ વચ્ચેની લાઈનમાં છે, પણ જે બીજું મીંડું છે એ નીચે જતું રહ્યું છે, right? So child was doing fine, but now the child has gone down. એટલે આવી લાઈન ઉપર કે નીચે ક્રોસ થાય ને, that means the growth is either going too fast or the growth has slowed down. So this is also called abnormal growth, right? So very, very important કે તમે જે લાઈન પર છો એ લાઈનને ફોલો કર્યા કરો છો, then your growth is normal. But if you're not growing on the line, you're going down, right? That is called growth failure or growth faltering. And this could be because of a major hormonal disturbance, right? And therefore, we always say that એક વખત height measurement લઈને ફાયદો નથી. We need to make sure that we are doing your height measurement frequently because growth is a dynamic process. It is affected by nutrition, it is affected by illnesses. Seasonal variations પણ હોઈ શકે છે, wherein a child slows down, then the child picks up. So if you have the growth parameters monitored over slightly longer time, say at least 6 months, you would know whether the child is doing fine or not. પણ આવો કોઈ ગ્રાફ અમને દેખાય કે જ્યાં ગ્રોથ સારો જઈ રહ્યો હતો અને હવે ગ્રોથ ડાઉન જવા માંડ્યો છે, then we would be suspecting a major hormonal disturbances, and this child definitely needs all the testing, right? So બીજી વસ્તુ, I think જ્યારે આપણે ગ્રોથની વાત કરીએ છીએ ને, તો કાં તો આપણે હાઈટ નથી વધતી, વજન નથી વધતું, એની વાત કરીએ છીએ. But this is something which is becoming a major concern now, and that is obesity, right? So here what you can see is, આપણે નીચેનો પાર્ટ જોઈએ ને, જેમાં 4 ટપકા કર્યા છે, તો પહેલું ટપકું તો નોર્મલ છે, પણ પછી બીજા ટપકાથી બાળકનું વજન ધીમે 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 વધવા માંડ્યું છે, રાઈટ? સો અગેન વજનમાં પણ તમે લાઈન ક્રોસ કરીને ઉપર જાઓ છો, કા નીચે જાઓ છો, then that is abnormal, right? So here the child is gaining lot of weight, the child is going into obesity. Now we don't like obesity also. Why? Because it is harbor to so many diseases in the future. So request to all the parents here, sometimes you may feel that your child is not gaining adequate weight and you just keep on feeding the child, you just keep on overfeeding the child. આ બધા વસ્તુઓ આગળ જઈને બાળકને obesity કરી શકે છે, right? So do not do force feeding. 4 to 6 years નો ટાઈમ એવો છે કે જે બાળકોનું વજન નહોતું વધતું, they suddenly start gaining too much of weight and they can go into obesity and then develop future complications, right? So always make sure that the kids are eating a well-balanced diet, but there is no need to force feed them. So as I said that, crossing of lines on the growth chart, it can be up or it can be down. In both height and weight is worrisome, and therefore it needs investigations to know what exactly is wrong, right? So let us understand a bit about short stature. Stature એટલે height, right? બાળકની height નથી વધતી, એના વિશે થોડી સમજણ લઈએ આપણે આજે. So what do we mean by short stature? If the child is growing below the target line for the family, so we saw what the target height is, we saw what the target range is. So if the child is growing below the target height for the family or for the peers, right, the child can have short stature. Now remember, I always say that ek class hoy, say there is a class of 40 kids, right, જેમાં અડધા girls છે, અડધા boys છે. So girls and boys will be growing at different rates, right? So 20 બાળક સાથે આપણે ક્યારે પણ આપણા બાળકની height comparison ના કરવી જોઈએ. The best thing is to plot that height on the growth chart, because then you would be comparing the height of your child with the height of similar age kids, right? એક ક્લાસમાં કોઈ 9 વર્ષનું પણ હોય, કોઈ 9.5 વર્ષનું પણ હોય અને કોઈ 10 વર્ષનું પણ હોય. So that is not an ideal population to compare your growth with, right? So growth charts, again, I would just say those are the basics and that has to be followed. Now, short stature can come to us as various presentations, right? Mama કહે છે કે my child has always been the shortest in the class. My child was growing well until 2 years ago, but I think she's feeling she's growing less and less. હમણાં છેલ્લા 2 વર્ષથી તો બહુ growth દેખાતો નથી એનો. I am short, so I am worried my child will also be on the shorter side. My daughter has got periods. Will she grow after that? My child is not eating well. Will that cause short stature or not? Right? My child is lazy, has got constipation, and I feel that the height is not increasing. Right? मैं 2 વર્ષથી તો કપડાની સાઈઝ જ નથી બદલી. He's still wearing the same size clothes that he was wearing 2 years back. બરોબર ને? Right? મારા બહેનનો છોકરો તો લાંબો થવા માંડ્યો પણ અને બંને તો સેમ એજના જ છે પણ I feel my child is not growing. So there are so many ways, the parents come to us with complaints that my child's growth is not happening. So then what would your doctor do? They'll take a proper history, ask about the family member's height, right? We want to know if there is any disease condition that could be contributing to the poor growth of your child, right? Then we'll be checking a family member's height. They'll do a proper checkup કે ભાઈ દેખેતી રીતે કોઈ તકલીફ લાગે છે કે નહીં, કોઈને લોહીના ટકા બહુ ઘટી ગયા હોય, કોઈની પાચન શક્તિ નબળી હોય, તો એ બધાના કારણે પણ ગ્રોથને અસર થવાની છે, right? So we want to make sure that a proper systemic examination is done. ઉપરથી નીચે સુધી બાળકની પ્રોપર તપાસ થાય છે એ જાણવા માટે કે બીજા કોઈ સાઇન સિમ્પટમ દેખાઈ રહ્યા છે કે નહીં. Then we would take the height and the weight, plot on the growth chart so we know where the growth of your child is. We will be checking for the sexual development, right? આજકાલ બધાએ સાંભળ્યું હશે કે જે ગર્લ્સમાં એસ્પેશિયલી બધા બાળકોનું સેક્સ્યુઅલ ડેવલપમેન્ટ ખૂબ વહેલું થઈ રહ્યું છે. So we get so many kids, that they have periods at the age of 9 years and 10 years also. So after the age of 6, we always make sure કે અમે બાળકનું જે હોર્મોનલ ડેવલપમેન્ટ છે એ ચાલુ થયું છે કે નહીં એ હંમેશા ચેક કરીએ છીએ. In the similar way, so if I get a 14-year-old boy or a 15-year-old boy who has complaints of not growing in terms of height, then I want to know, ભાઈ તારું પુરુષના હોર્મોનનું ડેવલપમેન્ટ સ્ટાર્ટ થયું છે કે નથી થયું. If that is delayed, then also the height can be affected, right? So we always make sure that we are checking for the sexual development. And often your doctor would be asking for an X-ray of the hand, right? અમે hand X-ray માંગીએ, that is called bone age. So we want to know કે તમે ગમે તેટલા વર્ષના છો, અંદરથી તમારી skeletal maturity કેટલા વર્ષના બાળકની છે એ આપણે જાણવું છે. And then based on all this, we might get some blood tests done. There could be thyroid function test, there could be hemoglobin, there could be liver function test. So based on whatever the findings of the history examination are there, we might do certain specialized tests also, right? So એક વસ્તુ મારે તમને X-ray માં સમજાવી છે. We do often get girls, coming to us at 13 and 14, sometimes even 17 and 18, કે મેમ મારી હાઈટ નથી વધતી છેલ્લા 2-3 વર્ષથી. The next question that we ask is, તમને પીરિયડ્સ ક્યારે આવ્યા? તો કે છે મેમ મને 10 વર્ષની ઉંમરે પીરિયડ્સ આવી ગયા છે, right? So remember, a girl will grow for about 1 year post the first period. After that, the girl's growth is going to stop, right? So આ જે મેં એક્સરે બતાવ્યો છે ને તમને, એમાં તમે જોઈ શકો આ મોટા જે જમણી બાજુનું પિક્ચર છે કે 2 હાડકાની વચ્ચે there is a gap. So એ ગેપમાંથી નવું હાડકું બને છે. Now once the gap fuses, and that happens when the sexual development is complete, right? So once the sexual development is complete and the gap is fused, then the child is not going to gain any further height, right? So therefore it is very important that in a girl, if you're worried about the height, you should come to us before the sexual development starts, because at that time the bones are all open. Then we can do some active treatment for that. So, right, it is very, very important. Therefore, this is an important investigative tool for us, right? અમે બહુ frequently આ handનો X-ray કરાવીએ કારણ કે અમારે જાણવું હોય કે ભાઈ બાળક ભલે 10 વર્ષનું છે, અંદરથી હાડકા કેટલા વર્ષના બાળકના છે, તો એ આપણને એ પણ કહેશે કે હવે બાળકનો ગ્રોથ કેટલો બાકી છે. So it tells us about the growth potential which is remaining, right? Now there are multiple causes of growth failure. It is possible that the family is short and therefore the child is short. There could be malnutrition. There could be systemic conditions, right? કોઈકને ઘઉંની એલર્જી છે તો એને ખોરાક ખાય છે તો પચતું જ નથી, બરોબર ને? કોઈ બાળકને કિડનીમાં તકલીફ છે તો એના કારણે બાળકનો ગ્રોથ નથી થતો. Somebody has hypothyroidism. So thyroxine, again, a very important hormone for growth, right? Constitutional growth delay. આપણે બોયઝમાં ખાસ સાંભળ્યું હશે એવું કે મેડમ 10મા પછી મારા મામાની હાઈટ વધી ગઈ હતી, 12મા પછી વધી ગઈ હતી, right? So that is called constitutional delay, કે જેમાં બાળકનો ગ્રોથ ધીમે 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 થાય છે અને એક વખત એ લોકોના હોર્મોનલ ડેવલપમેન્ટ સ્ટાર્ટ થાય છે એની સાથે they pick up the growth very, very fast, right? So they are just the late bloomers. There could be some genetic condition that the child has, which is causing the poor height gain, or it could be growth hormone deficiency. So how do we treat short stature? અગર મારી પાસે કોઈ બાળક આવે છે કે મેડમ મારી હાઈટ નથી વધતી, then what do we do? We find out the exact cause. So detailed history, physical examination, plotting on the growth charts, getting that bone age x-ray done. We improve the nutrition, physical activity, and then in some of the patients, we might use hormonal therapy. That is your growth hormone, right? So અમુક બાળકો કે જે લોકોને ગ્રોથ હોર્મોનની ડેફિશિયન્સી છે, કાં જે લોકોના પેરેન્ટ્સની હાઈટ નથી વધતી, અથવા બીજા કોઈ કારણોસર એમની હાઈટ ઓછી છે, સે એમના કિડની ફેલ થઈ રહી છે, જેના કારણે ગ્રોથ પુઅર છે, તો એ બધા બાળકોમાં આપણે ગ્રોથ હોર્મોન થેરાપી યુઝ કરી શકીએ છીએ. So I'm just going to take a couple of slides on what growth hormone is. So it is a substance that grows inside your body from the pituitary gland. જે આપણું master gland છે ને, એ growth hormone બનાવે છે, that helps the child grow both in weight, but most important in terms of height also, right? There could be varied symptoms, right? Newborn માં ક્યારેક sugar ઘટી ગયું છે, jaundice નથી જતું, cleft lip, cleft palate છે, or as the child grows older, they can come to us કે madam height નથી વધતી, પહેલેથી height માં નીચો છે, right? There could be low sugars. એમનું ડેન્ટિશન 6 વર્ષે જે દાંત પડીને નવા દાંત આવે એ પણ ડીલે થયું છે, રાઈટ? કારણ કે હોર્મોન્સ બધા બોન્સ માટે ઇમ્પોર્ટન્ટ છે. So they can come to you as varied presentation. So after proper investigations, your doctor might prescribe growth hormone. Now growth hormone comes only as injections, right? It is a protein. જે દાળ ખાઈએ ને પેટમાં જ પચી જાય ને, તમે ગ્રોથ હોર્મોનની ટેબ્લેટ લો તો એ પેટમાં જ પચી જાય, તો એ આગળ ગ્રોથ હોર્મોનની જેમ જાશે જ નહીં, right? So that is why we need to bypass the tummy and give it directly from outside. So growth hormone is given as injections either daily or weekly once. It is usually given at night, and it is a very, very safe molecule if properly indicated. You know, agar proper indication છે, બાળકને જરૂર છે અને તમે આપ્યું છે, then it's a very safe medication and they're going to respond very well to it. જે મેં તમને શરૂઆતમાં વાત કરી હતી ને કે you can also start monitoring growth at home, right? So IAP growth charts ની આખી application is now available for you to download it from your mobiles, right? And then you just have to enter whether your child is a girl or a boy, what is the exact age in years and months, what is the weight, height, and the other parameters, right? તો તમારા માટે આવો રેડીમેડ ગ્રાફ બની જશે, and they will tell you whether the child's height is normal or not. And then every 3 to 6 months, you can keep on adding the data. So they'll make a nice graph for you. And by that graph, you would know whether your child is doing fine or not. So this is very, very easily downloadable. And જે મેં તમને શરૂઆતમાં growth charts બતાવ્યા હતા ને, એ જ બધો data લઈને these calculators have been made. So to kind of summarize, normal growth is influenced by genetic, environmental, and hormonal factors, right? So we need that all of these are there so that our child can grow normally, right? A growth delay occurs when the child is not growing at the normal rate for age. જેમ આપણે વાત કરી, say somebody who is 6 years old, so they are supposed to grow at 4 to 6 centimeters per year. But if the child is growing less than that, then that is called growth failure or growth delay. And therefore, growth monitoring is very important. આજે height check કરી એના કરતા હું દર 3 મહિને height check કરું છું, say for the next 6 months to 9 months, then I have a better idea of the growth pattern of that particular child, whether it is normal or abnormal, and does anything have to be done for it or not, right? Early treatment can help your child reach a normal adult height. So if you have any concerns about growth, please share it with your doctor so appropriate measures can be taken. Thank you so much. And yeah, if we have any questions, the moderator will help us to deal with that. I'll just stop sharing my presentation here.
Thank you, ma'am. That was an amazing session. We have a few questions posted in the chat box.
Okay.
I'll just try to read out a few.
Yeah.
फर्स्ट क्वेश्चन इज जीएच स्टॉप करने के बाद फ्यूचर में कोई प्रॉब्लम होगी क्या? एंड कितने एज वाले जीएच ले सकते हैं? आई थिंक वी कैन क्लब दिस क्वेश्चन, और कितने एज
Yeah.
वाले जीएच ले
So
सकते
I think, especially in growth hormone, the one thing that is true is the earlier you start, the better the results, right? Because balak nanu chhe, the bone age is also slightly on the lesser side, so you've got more growth potential left, right? And once the child reaches the adult height, or once the child has reached the genetic potential, once you stop growth hormone, there are no long-term side effects for it. Even on growth hormone treatment, we do not see side effects. So once you stop it, there are no side effects. So we don't have to worry about that. And any age child can take growth hormone. But as I said, it depends on how much growth potential is there on the bone age. So agar haddiyon mein haddiyan fuse ho gayi hai, then there is no point in giving growth hormone, right? So if you have a girl who has periods at the age of 11 years, એના હાડકા બધા ફ્યુઝ થઈ ગયા છે, તો ગ્રોથ હોર્મોન આપવાનો મતલબ બનતો નથી. So I think then there is no point in giving growth hormone for those kids. But yeah, otherwise growth hormone can be given at any point of time.
Okay.
The other question was, which kind of genetic parameters affect the growth of a child, right? The first and foremost is your parental height. Barabar chhe, because that will take care of about 70 to 80% of the growth of the child. The other genetic parameters are so many chromosomes and so many newer mutations are being found every single day, which are associated with short stature. But along with that, if you have a deficiency of even thyroxine, which is your thyroid hormone, even that can affect your growth, right? So growth hormone ne banavta બહુ બધા genes, thyroid hormone ne banavta બહુ બધા genes, અને એની સાથે સાથે તમારું બોનનું ફોર્મેશન કેવું થઈ રહ્યું છે એને પણ બહુ બધા genes affect કરી શકે છે. So there are a lot of parameters which affect the growth of a child in terms of the genetics. Can I just keep on taking the questions, Uzair? Will that be okay,
Yes,
or you want
that's okay,
to?
ma'am. That's okay. That's okay.
So Mr. Hardik is asking, pen and vial formulation में difference क्या है, right? So basically both of them contain growth hormone. दवा दोनों में सेम ही है, ठीक है? The pen comes as a instrument like this, right? So you have your growth hormone and then you have your needle. And the vial and the syringes will also have the growth hormone. So you have a powder, then you will add some water in it, you will mix it, and then you will take it. So again, सुई जो है वो practically दोनों में बहुत ही छोटी है, दवाई दोनों में सेम ही है, right? But yeah, it depends upon the availability, depends upon the costing also. Both the molecules are equally effective, right? So I hope that answers your question, Mr. Hardik Trivedi. Hashim is asking, what is the formula for calculating the child's height? So we need to have both the mother's height and the father's height. Now, if I'm calculating the boy's height, I will do a formula as in father's height plus mother's height plus 13, the whole thing divided by 2. And if I'm calculating of a girl's height, girl's target height, I would say mother's height. Yeah, so Ruchi has already answered that question. So for a girl, it is going to be minus 13 by 2. For a boy, plus 13 by 2. And that is plotted at 18 years. So this is how ideally all the kids of the same family should grow. Okay. Is there any side effect during medications like body shaking sometimes, or child feel jerk because they're on medications and growing with it? So Dipali, if you can just write what medication we're talking about here. If you're talking about growth hormone per se, we haven't seen kids having these side effects as in jerking and shakiness. So if your child is having these side effects and it's better that you see your doctor, we need to make sure that something else is not going wrong with it. Sometimes the kid gets all panic, right? And they might just be scared of the shot and can have a jerky movement. So that is different, right? But yeah, if you feel that it is something which is of a big concern, please do talk to your doctor. There could be something which is going on and we need to take care of it, right? Okay, Mr. Thakkar is asking how IUGR can affect the baby's growth. So remember, IUGR is intrauterine growth restriction, or retardation. That means when the baby is born, because of whatever reasons, the maternal reasons, the baby's reasons, the baby has been born with growth restriction. Now, most of these babies are going to have a catch-up growth by the age of 3 to 4 years. So what we have seen is the baby may be small at birth, but then gradually the baby starts picking up on the growth, so that by the age of 3 or 4 years, the baby is growing normally according to the population and normally according to the genetic potential also, right? But about 10 to 15% of the babies will fail to have a catch-up growth and will always remain on the shorter side. So those are the kids who might need growth hormone later on in the life. Another thing, the babies who have been born IUGR are at an increased risk of developing metabolic syndrome. When I say metabolic syndrome, it means hypertension, obesity, cholesterol problems, diabetes in the future, right? So as I said earlier, overzealous nutrition. મારું બાળકનું વજન નથી વધતું તો હું એને બહુ જ બધું ખવડાવું. Let us not go into that. Let us make sure we just monitor the growth. We look for the catch-up growth. Most of the babies are going to have a catch-up growth. So I think we should wait until that time. How long should we take growth hormone? So there are few parameters by which we decide when to stop growth hormone. One is you have achieved your target height, right? તમારા ફેમિલિયલ પ્રમાણે અથવા તો સોશિયલી એક્સેપ્ટેબલ એક હાઇટ આવી ગઈ છે, then you can stop growth hormone. Second, or બધા હાડકા એક્સરેમાં ફ્યુઝ થઈ ગયા છે, એટલે હવે growth hormone કામ ક્યાં કરશે, right? So that is when you can stop growth hormone. Or if the growth velocity, that means the rate of height gain of any child, is less than 2 centimeters per year. So these are the 3 parameters that we would use as criteria to decide when we can stop growth hormone. How long we can take? We can take, like, there are some kids who are growth hormone deficiency as kids. Once they become adults, we sometimes continue growth hormone as adults also, right? So sometimes you can start growth hormone in babies as young as 3 and 6 months, and we will be continuing till they are 13 and 14, right? So એમાં કોઈ એજ બાર આવતું નથી. અમુક બાળકો જે ગ્રોથ હોર્મોન ડેફિશિયન્ટ હોય છે એઝ બાળકો, તો એ લોકોને મોટા થઈને પણ અમે ગ્રોથ હોર્મોન આપતા હોઈએ છે. When does period start after growth of pubic hair? So as Ruchi ma'am has said, pubic hair, axillary hair એ અલગ ગ્રંથિમાંથી બને છે, right? So એના સાથે periods ને બહુ લેવા દેવા નથી, પણ breast enlargement in a girl, so start of breast enlargement to periods is about 1.5 to 2 years, because that is the main estrogen driven hormones, right? The pubic hair and axillary hair che, they come from the adrenal glands, which can sometimes even start up to 2 years before the actual hormonal development. તો પછી એ બાળકોમાં અમે કોઈ સારવાર નથી કરતા હોર્મોન્સની, એમને ખાલી મોનિટર કરીએ છીએ, right? But once the breast enlargement starts, it might take about 1.5 to 2 years. Some kids might grow a little bit faster also, and we feel that they have grown very fast and might have periods in year and a half also. So I hope that answers your question. Where was there on the iPhone? Yeah. So any more questions, any more doubts if you have regarding what we talked about in the presentation? Okay. So Rivan is asking, I was diagnosed hypothyroidism during pregnancy and till now. Will my child get hypothyroidism? He is 9 years old. Look, hypothyroidism is a very common hormonal disorder, right? 1100 થી 1200 એક બાળકને થાઇરોઇડની તકલીફ ડાયગ્નોસ થાય છે, એટલે બાય નંબર્સ ઇટ્સ અ વેરી કોમન ડિસઓર્ડર, બરોબર છે? પણ કારણ કે તમને પ્રેગ્નન્સીમાં થાઇરોઇડની તકલીફ આવી હતી એટલે તમારા બાળકને આવશે એવું જરૂરી નથી, બરોબર છે? પણ કોઈકને ફેમિલીમાં થાઇરોઇડની તકલીફ હોય તો આવવાના ચાન્સીસ થોડા વધી જાય છે, બરોબર છે? સો આઈ હોપ વોટ યુ અન્ડરસ્ટેન્ડ વોટ આઈ એમ સેઇંગ ઇઝ કે કારણ કે તમને થાઇરોઇડનું ડાયગ્નોસિસ થયું હતું એટલે તમારા બાળકને આવશે એવું કમ્પલસરી નથી. થાઇરોઇડ ઇટસેલ્ફ ઇઝ અ વેરી કોમન હોર્મોનલ ડિસઓર્ડર, જે કોઈને પણ થઈ શકે છે. એની મમ્માને થાઇરોઇડની તકલીફ હોય કે ના હોય, but the child can be diagnosed with hypothyroidism. So instead of worrying about that, what is important is that you can just keep your eyes open. So if you feel that the growth of the child is not happening properly, the child is developing dry skin, constipation, hair loss, you feel that something is not right about the growth of the child, you can see your doctor, and then if needed, you can get the test done. But otherwise, it is not compulsory કે તમને હતું એટલે તમારા બાળકને આવશે જ. So I hope that answers the question, Rivan. Okay. Rachna is asking for boys, till how long can we expect growth of height since pubic and axillary hairs are not indicative? So if you can just give me a minute to get something from the cupboard. Because pubic hair and axillary hair are not indicative of growth, what we do is we use something like this, right? So it is the testicular volume. એટલે બોયઝમાં ટેસ્ટિસની સાઇઝ થી અમે નક્કી કરીએ છીએ કે એની હાઇટ ક્યાં સુધી વધશે, right? So this is called an orchidometer, and somebody who's visited my clinic, they would be knowing that I use this very frequently, right? So અહીંયા સુધી હજી હોર્મોન સ્ટાર્ટ નથી થયા, અહીંયાથી શરૂઆત થઈ છે. જ્યારે અહીંયા પહોંચીએ છીએ ત્યારે બાળકનો ગ્રોથ સ્પર્ટ સ્ટાર્ટ થાય છે, right? And once they reach the adult size of the testis, the growth will stop. Again, another indicator to know that is by doing that simple X-ray of the hand. So if all the bones are fused, so the child can be 14 years, the bones can be 12 years. So the child is still growing, the child is not done with the growth, right? So if on the X-ray there are open bones, that means the growth is still left and the child is going to grow still further. So I hope that answers your question, Rachna Mehta. So again, puberty is a very, very important aspect, right? Both for the girls and for the boys, because eventually it is that which is going to give you your final height, right? હજી સુધી બોયઝમાં એનો ટાઈમિંગ બહુ ચેન્જ થયો દેખાતો નથી, but in girls we are definitely seeing an early trend of puberty and early trend of periods, right? So that has to be taken care of. Yes. Okay. So any more?
This is Juzer here. Ma'am,
Yes,
one
yes.
question I think would help everybody if you can just answer this.
Sure.
For example, એક બચ્ચો છે એને growth hormone deficiency છે અને એને
હા.
દવા આપી છે આપણે growth hormone. So
હા.
while the child is transitioning towards the adulthood, તો
હા.
એકવાર મોટો થઈ જાય છે, એડલ્ટ થાય છે, તો એને શું challenges આવી શકે છે અને challenges આપણે કેવી રીતના tackle કરી શકે છે એકવાર
Right.
બાળક મોટું થઈ ગયું તો?
હા. So હવે એ ડિપેન્ડ કરે છે કે એને ફક્ત ગ્રોથ હોર્મોન ડેફિશિયન્સી છે કે બીજા બધા હોર્મોન્સની પણ ખામી છે, that we known as multiple pituitary hormone deficiency, right? So now if the child has just an isolated growth hormone deficiency, હવે આપણને ખબર છે, we have done so many studies now that we know that growth hormone ફક્ત height માટે નહીં, પણ આપણા metabolic buildup માટે પણ ખૂબ જરૂરી છે, right? So even if a child on growth hormone therapy has achieved a good final height, we sometimes do continue growth hormone in adulthood also, because that is going to help improve the quality of life in terms of stamina, energy, in terms of distribution of the proteins, the muscle mass, the lipids also, right? એટલે અગર કોઈ બાળક સિવિયરલી ગ્રોથ હોર્મોન ડેફિશિયન્ટ છે અને એનું આપણે ગ્રોથ હોર્મોન એડલ્ટહુડમાં ક્યારેક જો નથી કરી શકતા, તો આ બધા લક્ષણો પણ બાળકને થઈ શકે છે, right? So we often continue growth hormone in very teeny tiny doses in the adulthood also. Was that what you were asking, Zuzair?
Yes, ma'am. Yes. And any
Yeah.
other, I mean, conditions જે થઈ શકે બાળકને જેના વાસ્તે આપણે precautions લઈ શકીએ યા પછી આપણે monitor કરી શકીએ, એવી કોઈ conditions
So
હોય?
the most important parameter would be to monitor the IGF-1 levels, right? So if they are on the lower side, the child becomes a candidate for growth hormone therapy. At the same time, we need to keep an eye on the other hormones also, because બધા hormones તો બને છે master gland માંથી જ આપણા મગજમાં છે. એટલે કોઈ પણ એક હોર્મોનની ડેફિશિયન્સી એમાંથી થઈ છે, તો it is important that we keep on monitoring. બીજું એ લોકોની બોન હેલ્થને અસર થઈ શકે છે, કોલેસ્ટ્રોલ લેવલ્સને પણ અસર થઈ શકે છે, right? So those things are also some of the parameters that you need to keep on paying attention once the child becomes an adult also. Yeah.
Yeah, ma'am, that answers the question. Thanks a lot, ma'am.
Yeah. Yeah.
So if any more questions we can just take ચેટ માં કોઈને હજી questions હોય તો chat માં નાખી શકે છે, આપણે answers લઈ શકીએ. હમણાં પણ છે આપણા પાસે 5-10 minutes.
Yeah. So I think let me just summarize the whole thing. It is very important to know that growth is a dynamic process. Growth કોઈનો પણ static નથી હોતો, right? એટલે તો બાળક નાનુંથી મોટું થાય છે અને એટલા માટે જ રેગ્યુલર ચેકઅપ્સ, રેગ્યુલર મોનિટરિંગ કરવું બહુ જરૂરી છે. કાં તો તમે ડોક્ટર પાસે જઈ શકો છો, કાં જાતે ઘરે ઓલી એપ્લિકેશન્સ એ બધું યુઝ કરીને ગ્રોથને મોનિટર કરી શકો છો. અગર તમને સહેજે ડાઉટ લાગે છે કે બાળકનો ગ્રોથ જોઈએ એવો નથી થતો, હવે જ્યારે આપણે ગ્રોથની વાત કરીએ તો મોટા બધા પેરેન્ટ્સને વજનનું વધારે ટેન્શન હોય છે અને દે કમ વિથ કમ્પ્લેન્ટ્સ કે મેમ મારા બાળકનું વજન નથી વધતું, રાઈટ? So again, what we do is we plot the weight also on the growth chart and we track the weight, right? કોઈકનું વજન 10ની લાઈન પર હોય, કોઈકનું વજન 75ની લાઈન પર હોય, પણ જો આપણી લાઈનને ફોલો કરીએ છીએ તો કોઈ 10 પર છે તો 10 પર આગળ વધી રહ્યું છે, right? The child is developmentally normal, learning all the right things at the right time, is not falling sick too often, is very healthy, then I would not be worried about the weight which is there on the 10th percentile, right? કારણ કે દરેક પોતાના એક ડાયનામિક્સ પ્રમાણે ગ્રો કરે છે. Some will grow a little bit slower, some will grow a little bit faster, બરોબર છે? એટલે એ વસ્તુને ધ્યાનમાં રાખીને આપણે ગ્રોથને ઇન્ટરપ્રેટ કરતા હોઈએ છે. એટલે જ્યારે કોઈ બાળક નાનું હોય તો ખાસ everybody in the families કે વજન કેમ નથી વધતું, something is wrong, just keep on feeding. So let us not do that because we are seeing increasing number of cases of obesity also now in our practice. So let us make sure to give a healthy, balanced lifestyle to all the kids, at least 1 hour of physical activity every single day. બીજો એક ક્વેશ્ચન બહુ કોમનલી પૂછાતો હોય છે કે મેડમ હું સાયકલિંગ કરીશ, હું લટકી જઈશ, હું સ્વિમિંગ કરીશ તો મારી હાઈટ વધશે કે નહીં વધે? Now that is a complete myth, right? કસરત કરવી એ આપણા હેલ્થ માટે ખૂબ જ જરૂરી છે, જેથી ભવિષ્યમાં આપણને ઓબેસિટી, આપણું હાર્ટ સ્ટ્રોંગ રહે, આપણને ડાયાબિટીસ ને બધી તકલીફો ના આવે. પણ કસરત કરવાથી હાડકા ને સ્નાયુઓ મજબૂત થાય છે, એ લાંબા નથી થવાના, right? So again, we should not exercise for the purpose of height gain, rather for keeping us strong and healthy. So that is also one thing that is very, very important. Parents make sure that at least your child gets 1 hour of physical activity every single day, but not for the purpose of height gain. એ વસ્તુ ખાસ આપણા મગજમાં ધ્યાન રાખવાની છે. Any girl કે જેમાં breast enlargement starts before the age of 8 years is early puberty, right? So that girl is going to grow fast. તમે લાગશે કે ઓ હાઈટ સરસ વધી ગઈ, પણ એ ગર્લને માસિક પણ વહેલું આવી જશે અને એ ગર્લનો ગ્રોથ પણ વહેલું ખતમ થઈ જશે, right? So always pay attention to that also, કે ભાઈ બાળકનું final height કઈ બાજુ જઈ રહ્યું છે and whether that is in the normal ranges for the target height or not, right? Yeah, so if there are any more questions, we have another 5 minutes or so, or then I think we may just wrap up the session. Zuzair, up to you.
Okay, ma'am, I think all the questions which have come up, we have answered them, and I think no more questions are there. We'll wrap up the questions, ma'am. We'll wrap up the session, ma'am. Thanks a lot, ma'am, for being here. I mean, most probably થાય છે કે આપણે ક્લિનિકના અંદર આપણા પેશન્ટ્સને ટાઈમ નથી આપી પાતા, બટ સચ કાઇન્ડ ઓફ સેશન્સ આર વેરી હેલ્પફુલ કે ઘણા બધા જે આપણા પેરેન્ટ્સના ડાઉટ હોય છે આપણા બાળકને લઈને આ સબ સેશન્સ આપણે કરીએ તો રિઝોલ્વ થઈ જાય છે. And I really appreciate that you took out time, ma'am, to come up and address these sessions. I think most of the patients are thankful as well. I can see all the thanks rolling in, ma'am. Thanks a lot. It was a very informative session. Thank you, ma'am.